So hello everyone, I'd like to now officially welcome you to today's webinar, Mental Health, Stress, and Resilience. My name is Jessica Birch and I'm with the Corporation for National and Community Service, and I'll be your host for today's webinar. I'll also be facilitating the live Q&A at the end of this session. Also joining us are Rachel Raddick and Jenny Farrell from our partners at Education Northwest, who have helped to prepare today's webinar and will be managing the WebEx technology. You'll also see them in the chat and Q&A to help address questions you may have during the session. I'd also like to welcome our main speaker today, Carrie Stevens. Carrie, an AmeriCorps VISTA and AmeriCorps State and National alum, is a licensed clinical social worker with a master's in social work. Carrie also holds a master's in addiction counseling certification. She's worked with homeless veterans in Portland, Oregon since 2012. We're very excited that Carrie's here, and we're very excited that you're here to join us. I'm now going to turn the presentation over to Carrie, who will share with us the goals for today's session. Carrie, take it away.
Thank you, Jessica. It's great to be with you today. Mental health, stress, and resilience are very important topics to discuss, especially in our work in community services. The discussions around mental health conditions, stress, and resilience are not often brought up in our work environments due to stigma associated with mental health, as well as the difficulty in starting or prompting these discussions with our colleagues. The purpose of this webinar and discussion is not to turn us all into clinicians and make diagnostic assessments of ourselves and colleagues, but rather to start the discussion and provide relevant resources and referrals and topics for further exploration as we move forward with our service year and service-oriented careers. We know this is heavy subject matter, and if the discussion is triggering to you, it is okay to take a break from the webinar and take care of yourself. The National Alliance on Mental Illness, or NAMI hotline, is always available 24/7 as needed, and the number is going to be posted in the chat box. Today's webinar is going to cover multiple topics. We'd like you to gain a better understanding of what mental health is, including common myths and facts and causes. We'll also learn about symptoms and patterns that might signal a need for support. In addition, we'll discuss key steps for creating positive mental health, particularly around our work and the common experience of compassion fatigue. Finally, we will provide you with resources to help you when you just don't know what to do. Please note that the resources and information we mention in today's webinar is information I have found to be valuable in my work, but these resources and information are not necessarily endorsed by the Corporation for National and Community Service. We'd like to begin with a quick question about how often this topic comes up at your place of work, either directly or indirectly, around mental health, stress, and resilience. For example, in my current place of work with homeless veterans, the topic of mental health conditions, and stress are frequently brought up by the clients I'm serving and working with, as well as by myself and my colleagues, to note how we're doing and just coping with the day-to-day stresses that are inherent in the work we do as service providers.
Thank you, Carrie. So take a quick second to do that poll on the right-hand side. How often is this brought up in your workplace? All the time, some of the time, not often, or never? We just kind of want to get a pulse of those of you who are on this discussion with us. So just take a few seconds. It's about to close here any minute. While we wait for these to come in, I want to thank you all for sharing before this webinar started what you hope to learn today. We learned that a lot of you want to learn how to manage stress, how to avoid burnout, how to help your VISTA members, how to help one another. That's really great, and that's exactly what we're aiming to do here. So you're all at the right place. So the poll has ended, and we're just now waiting for the results to come in. And it looks like the results are, most of you said B, that some of the time mental health, stress, and resilience is brought up in your workplace. Closely followed by not often, and then kind of a third way tie between all the time and never. So those are kind of across the board, but it looks like a lot of you do have some kind of discussion about this in your workplace. Carrie, back to you.
Thank you, Jessica. Mental health is a sensitive and complex topic to discuss. Many of us don't have a general understanding of mental health which can make it difficult to talk about at work and even outside of our workplaces. So let's begin with a discussion that will help us better understand what we mean by mental health. In this first part of today's presentation, we will define mental health and provide an overview of what good mental health may look like. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It can also determine how we experience and handle stress, how we relate to others, and how we make choices. Mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So what does good mental health look like? According to the Mental Health Foundation, mental health can be characterized by a person being able to complete and fulfill activities and key functions in their daily lives, such as the ability to learn, the ability to feel, express, and manage a range of positive and negative emotions, the ability to form and maintain good relationships with others, and the ability to cope with and manage change and uncertainty. It's also important to note that good mental health does not simply mean the absence of a diagnosable mental health condition. Many individuals with a mental health condition also have good mental health. And there is emerging evidence that positive mental health is associated with more improved health outcomes per the Center for Disease Control. Now let's take a deeper look at mental health conditions and learning about some more of the common mental health conditions that we see in the United States. First, a mental health condition is a medical condition that affects a person's thinking, feeling, or mood. Such conditions may affect someone's ability to relate to others and function each day. Each person will have a different experience, even people who have the same diagnosis. Recovery, including meaningful roles in social life, school, and work, is totally possible, especially when you start treatment early and you play a strong role in your own recovery process. A mental health condition isn't the result of one event and can be managed with proper treatment. Research suggests that there are multiple and linking causes to mental health, and genetics, environment, and lifestyle can influence whether someone develops a mental health condition. Also, a stressful job or home life can make people more susceptible, as if somebody's experienced a traumatic event, to having a mental health condition. Biochemical processes and circuits and brain structure may also play a role. In the United States, per the National Alliance on Mental Illness, about 43.8 million adults experience a mental health illness every year. This equates to about every 1 in 5 adults experiencing a mental health condition in a given year. Most commonly diagnosed mental health condition is depression or a major depressive disorder or a depression episode. An anxiety disorder that can also include post-traumatic stress disorder or PTSD, obsessive compulsive disorder or OCD, panic disorder, and substance use disorders that can include opiate abuse, alcohol abuse, and other substance abuse. And there are many common misconceptions about mental health, and it can be difficult to know what is myth and what is fact. Please take a minute to share any common misconceptions you have heard about mental health. Now, these are misconceptions that you have heard, but are known not to be true or you don't believe yourself. They are common because we have often heard them or observed these misconceptions.
Thank you, Carrie. So as Carrie mentioned, write in the chat, what are some common misconceptions that you've heard about mental health or mental health conditions? Once again, it's not that you necessarily feel this way, it's just maybe things that you've heard. And a lot of things are already coming in. So Harrison here said they will go away with time is a misconception that he's heard. Someone else said it means that you're abnormal, or that only crazy people or only people who are crazy need therapy. Another misconception is that men are expected to be strong and hold in their feelings. Also, Kara here says that another misconception that she has heard is that depression can be cured just by deciding to be positive. We also hear some that they aren't real, mental health conditions aren't real, or that it's just all in your head, that it's a choice and not an illness. Another misconception is that it's just a phase, or that it can be fixed with diet and exercise. A lot of things about anxiety, about how anxiety is a cop-out, that you can control how you feel, that you simply just need to suck it up and look on the bright side. Try worrying less, you just need to breathe. Carrie, these are a lot of misconceptions, and I'm sure that you've heard a lot of these and maybe even more in your field of work. Yeah, I think these are kind of all, I'm sure all of us have heard at least 5 of these before. So thank you all for that. I'm going to turn it back over to Carrie now, who's going to talk to us a little bit about those myths and what the facts are.
Thank you all for your responses. As discussed by the National Alliance on Mental Illness, or NAMI, people are afraid to talk about mental health because of these misconceptions, as we've noted in the chats, and around mental health just in general. It's important to learn the facts, to stop discrimination, and to begin treating people with mental health conditions with respect and dignity. Common myths and misconceptions about mental health conditions consist of: there is no hope for people who experience a mental health condition or mental illness, when in reality, there are more treatments, strategies, and community supports than before, and even more are on the horizon. People with mental health conditions lead active and productive lives. Another common myth is that mental illness or a mental health condition cannot affect me, when in reality, mental health conditions are surprisingly common, as we discussed in an earlier slide. 1 in 5 adults a year are impacted with a mental health condition, and they also can affect almost every family in America. And something just more important to note, that mental health conditions do not discriminate. They can affect anyone regardless of your socioeconomic status, your race, your religion, or geographic location. All races and ethnicities are affected by the same rate of mental illness. There is no single group of people more likely than others to have a mental health condition. However, some people have cultural influences that may affect how they interpret symptoms of a mental health condition that could prevent them from getting help. And while the rates are the same, awareness of mental health and mental health conditions in varying minority groups is important to highlight, as these groups are often overlooked in the potential differences of outcomes in just terms of general over mental health and recovery in mental health conditions. We can also be impacted if someone in our lives or close to us has a mental health condition, and we may feel like we don't know how to help them or support them. Another myth is that mental illness is caused by personal weakness. And the facts are, just like any other major medical condition, a mental health condition is not the fault of a person. It is caused by environmental and biological factors and not the result of a personal weakness. A stressful job or home life can make people more susceptible, as do experiencing traumatic events, and biochemical processes and circuits, as well as basic brain structure, may play a role in this as well. Another common myth we may come across is feeling that you cannot do anything for somebody with a mental health condition or mental health illness, when in reality, you can do a lot. Starting with the way you act and how you speak, you can nurture an environment that builds on people's strengths and promotes good mental health. We can do this by fostering a safe and non-judgmental work environment and not using words like crazy to describe somebody with a mental illness. Let's focus first on the person and not describe someone as solely having a mental health condition. To note, this person has schizophrenia instead of this schizophrenic. Treat people with mental health conditions with dignity and respect in and out of the workplace. These common myths can contribute to stigma about mental health. So let's now discuss stigma and how it relates to mental health. As noted by NAMI, stigma is when someone, or even yourself, views a person in a negative way just because they have a mental health condition. Some people describe stigma as a feeling of shame or judgment from someone else. Stigma can also come from an internal place, kind of confusing the feeling of bad with being bad. Navigating life with a mental health condition can be tough, and the isolation, blame, and secrecy that is often encouraged by stigma can create huge challenges to reaching out, getting needed support, and living well. Learning how to avoid and address stigma are important for all of us, especially when you realize stigma's effects, which include people experiencing mental health conditions often face rejection, bullying, and discrimination. This can make their journey to recovery longer and more difficult. Mental health conditions are the leading cause of disability across the United States. Even though most people can be successfully treated, less than half of the adults in the U.S. who need services and treatment get the help they need. The average delay between the onset of symptoms and somebody getting an intervention is between 8 and 10 years. And suicide is the second leading cause of death of youth ages 15 to 24 and is the 10th leading cause of death for all Americans. Often people are afraid to talk about mental health because there are so many misconceptions, as we previously discussed. It is important to learn the facts and to treat people with mental health conditions with respect and dignity. We can do this by avoid labeling people with words like crazy, wacko, loony, or by their diagnosis. Instead of saying he was diagnosed with bipolar disorder, we can say he has a mental health condition. Learn the facts about mental health and share them with others, especially if you hear something that is untrue. Respect the rights of people with mental health conditions and don't discriminate against them when it comes to housing, employment, or education. Like other people who have disabilities, people with mental health needs are protected under federal and state laws. I know this comes up frequently at my work site, and especially in how we may discuss our clients and their mental health conditions. You know, in my work, I have mistakenly used a mental health condition to describe a patient and to not note that there are so many more facets to that person beyond their mental health. For an example, we can say that an individual who has an anxiety disorder like OCD and not say that person is so OCD in order to reduce stigma and not discriminate in our work. It is also important to not use mental health condition terms inappropriately. To use the example I just used around somebody who has obsessive compulsive disorder or OCD, you should avoid saying things like, oh, I'm so OCD about my pens being color-coded, or I'm so depressed that David Tennant is no longer the doctor. While you may suffer from obsessive compulsive disorder or depression, using these terms in this manner minimizes the seriousness of these conditions and can help further propagate the stigma that surrounds them. So far, we have discussed some important concepts and definitions around mental health conditions, myths, and facts associated with mental health, and the stigma that can be attached and associated with mental health conditions in trying to access support and help. In this next section, we are going to discuss concepts around stress and compassion fatigue, as they can be present in our work and home lives, as well as how we take care of ourselves, access help, and resources if we are in need of additional support. Next, we are going to take a look at stress and compassion fatigue in our work and how this relates to mental health. As you all know, our work is stressful. As a VISTA member, you may be experiencing stress related to this new service experience, new work environment, possibly stress related to moving to a new community. As a VISTA supervisor, you may be experiencing stress related to both your day-to-day work providing direct service and in your role as a supervisor and as a mentor. Everyone feels stress from time to time. But what is stress? As noted in the National Institute of Health literature, stress is how the brain and body respond to any demand, and that whether that be any type of demand or stressor, such as exercise, work, school, major life changes, or traumatic events, they can all be stressful. Stress can affect your physical and mental health. It is important to pay attention to how you deal with minor and major stressors so that you know when to seek help. I'm now going to pass the presentation back to Jessica, who's going to walk us through a reflection activity.
Thank you, Carrie. So burnout is a term that was coined to describe excessive stress. Feeling hopeless, fatigued, overwhelmed from excessive workloads and unsupportive work environments. We can complete self-assessments to determine if we are experiencing burnout and compassion fatigue. Some good tools that measure these include the Professional Quality of Life Scale and Are You Burning Out Scale, which the link has just been posted in the chat. These are not meant to be clinical assessments, but are helpful tools to check in with ourselves and create some awareness into how we are doing within VISTA settings and work environments, and allowing for work-life balance in and out of our work settings. Take a moment to reflect on this sample statement from the Professional Quality of Life Scale. I find it difficult to separate my personal life from my life as a helper. What that means is probably your work as a VISTA member or a VISTA supervisor in the work that you're doing. I really think it'd be powerful if we would all respond to this statement. On the next two slides, we're going to walk you through how to respond anonymously using your annotation tools. So, to find the annotation tools, click on the pen icon in the upper left corner of your screen to expand the annotation toolbar. From there, you are going to look at the tools, and when they're displayed, find the square icon on the left side of your screen. Do not use the arrow, letters, line, or pen. You can see them in the screenshot on the slide where the square is. Click on the caret next to the square, and you will see a check mark and an X. Don't click on it yet. So now you can go ahead and click on the X or check mark and place it on the table in the column that best indicates how you feel about this statement. I find it difficult to separate my personal life from my life as a helper. Let's see how we're doing. Great. You guys are getting the annotation tools. Remember, left-hand corner, find the square. You can do the check mark or the X. Let us know. All right. It looks like, Carrie, it looks like we have a big spectrum here so far. There's a lot in often and sometimes. There is quite a bit in never. But it looks like there's a great, a lot of people, or it's a mixed bag here. A lot or an often. It looks like often is now the reigning lead here, followed by sometimes and then by never. So thank you. It's really nice to be able to have everyone kind of put in where they fit into this. Great. So Carrie, I'm going to turn it back over to you. Most people here find that they find it difficult to separate their lives, and they find that happens often. So back to you.
Thank you all for your honest reflections and feedback. Through our work as VISTA members and VISTA supervisors, we are engaging in work that focuses on supporting others, both in providing direct service and in helping build organizational capacity. It can be difficult for service providers to separate personal life from work as a helper. We are simply very dedicated to the work we do. During my VISTA service, I served as a volunteer coordinator, working with and training and recruiting 10 college students to serve as after-school program tutors and in volunteers in 10 different Portland public schools. I also served as a tutor and a volunteer in a large high school in the area and facilitated their after-school program. During my service year, I started to experience compassion fatigue, although I didn't have a name for that experience at that time. Compassion fatigue is a state experienced by those helping people or helping communities in distress, and it can create secondary traumatic stress for the helper. What does compassion fatigue look like? It can mirror stress symptoms, and they can affect your body, your thoughts and feelings, and your behavior. For me, when I was experiencing compassion fatigue, I noticed I had more difficulty sleeping, I had increased headaches, and I became sick more easily. Compassion fatigue can manifest as symptoms of stress, and those stress symptoms can affect multiple facets, including your body, your thoughts, feelings, and behaviors. Some more of the common physical symptoms of stress include increased headaches, changes in sleep, changes in appetite, muscle aches, fatigue, upset stomach, and chest pain. Some of the emotional symptoms of stress can include an increase in anxiety, difficulty concentrating, feeling overwhelmed, experiencing a lack of motivation or focus, sadness, depression, irritability, and anger. Some of the behavioral symptoms of stress can include changes in sleep, changes in eating, including eating more than normal or less than normal for you, social withdrawal, increased use of alcohol or other substances like opiates and marijuana, and isolating and exercising or just being less active less frequently. So what do we do if we're experiencing compassion fatigue and burnout? Let's now turn to the practice of self-care. Introducing self-care into our daily lives will go a long way in sustaining the work we do and allowing us to be as present and committed to our work as VISTAs and VISTA supervisors. Self-care refers to activities and practices that we can engage in on a regular basis to reduce stress and maintain and enhance our short and longer-term health and well-being. Self-care is necessary for your effectiveness and success in honoring both your professional and personal commitments. So what does self-care look like? We can practice self-care in all domains of our life. Physical self-care can look like getting enough sleep every night, engaging in exercise and physical activity, eating regularly, and staying home when you're sick. Psychological self-care can include taking a time out from screen time and taking a break from your phones and email and social media accounts, writing in a journal, practicing mindfulness, and meditation. Some components of emotional self-care can resemble staying in contact with our friends and family, hanging out with people whose company we enjoy, and finding things that make us laugh. Spiritual self-care can look like meditation, self-reflection, singing, praying, engagement in spiritual or faith communities, and spending time in nature. Relationship self-care can look like making time to see your friends, scheduling date nights with your partner, drawing on and enlarging your social circle, and asking for help when you're struggling. Self-care can also be tapping into the natural supports you have in your life. During my VISTA year, I was in a new city and without a strong support group at that time. When I was struggling with my work and trying to balance all the roles and tasks in my position, I was able to reach out to a colleague and a former VISTA that worked in my office, and that was incredibly helpful and supportive, having her as a resource. Natural supports that you may have available to you could be friends and family, the colleagues and peers that you may have in your work setting, on your team, supervisors at your work site, supervisors on your team, mentors that have been supports in the past, fellow VISTA members and supervisors, and VISTA alumni. Self-care in and of itself is a practice. It is something that we do have to work at, but it is something that is attainable and achievable. Creating and having that work-life balance is well within your grasp. Currently, I practice self-care by engaging in yoga and meditation, spending time with friends and family outside of work, having date nights, and having a peer group that I can consult with and ask for support. Self-care can look different for everyone. We would love to hear from you. What type of self-care do you practice?
Thank you, Carrie. Thank you for that information, too, around self-care, mental health, and mental illness, or mental health conditions, I should say. A lot of great things in the chat. We didn't mention at the beginning, but all of you on this webinar have already kind of gotten the gist of it. This is a chance for you to connect with one another, too. You're already doing a great job of being a community in this chat. So keep it coming. And now we're going to learn what kind of things you do for self-care. So a lot of things that people here do is exercise. We're doing a lot of exercise. We have someone says baths, counseling, and regular meals. Like Max. Max says singing and being in community theater. Wonderful. We also have reading and writing. Taking time to read a good book allows me to slow down. I know for myself, I recently made a vow to at least read the number of books for the age I turned that year. So if I turn 30, I'm going to read 30 books that year. So that's a kind of a fun little self-care challenge. We also have going to the movies alone, singing, going to mass, praying, just taking time to relax. It looks like here we have some other yoga fans like you, Carrie. Road trips and kickboxing, a lot of variety. Ryan here listens to comedic podcasts. Natalie does puzzles, and a lot of just different things. Keep them coming. We love hearing this. Oh, Megan, you touched my heart here. Walk and play with doggies. Dogs, for me, are just the best medicine. So these are wonderful. Keep them coming. Share what types of self-care you practice. But, Carrie, it looks like you have a lot of people who kind of do the same things you do.
Thank you all for your responses. This is so great to see, and I'm just so happy to see that you all are practicing self-care right now, or most of you are. Having strong self-care practices can help make you resilient, the ability to bounce back from stress. Resilience is the process of adapting well in the face of significant sources of stress. It means having the ability to bounce back from a distressing experience and continuing to show up and be present in your work and your lives. Resilience is a trait that we've all experienced, and we can increase our resiliency through our self-care practice. Part of being resilient is knowing when and how to find help and support. What can we do if we're still struggling and experiencing increased stress, stress-related symptoms, and/or an increase in emotional or behavioral changes that are not currently being managed through our self-care practice? As we discussed earlier in this webinar, stress can manifest in physical, emotional, and behavioral symptoms and changes. If you notice major changes in how you are living your daily life and being able to manage your day-to-day, reaching out to a trusted colleague, supervisor, peer, primary care provider, or mental health professional would be a good next step to take care of yourself. Some of the warning signs to notice if you feel you're in need of additional help can include increasing or excessive substance use, feeling that nothing can be done to improve the situation, having a sense of purposelessness, having an increase in anger or rage, engaging in impulsive or risky behavior, feeling of being trapped, like there's no way out, withdrawing from your friends and family and society, noticing an increase in anxiety such as agitation, irritability, and the feeling like you just want to jump out of your skin, noticing dramatic changes in your mood and a lack of interest in usual activities, also sleep disturbances such as insomnia, your inability to sleep or feeling like you need to sleep all the time. And finally, you may notice if you're in need of additional support, if you're experiencing overwhelming self-blame or remorse. During my VISTA year, I utilized that colleague I mentioned earlier in my office and my VISTA leader as confidants and supports, and I felt well supported by them. I also did reach out to a mental health professional when I was really struggling. In my current role, I have colleagues that I meet with and consult with on a frequent basis, and I find having someone to talk to that knows or has a similar idea of where I'm coming from to be incredibly helpful and supportive. There are also state and national hotlines, which we will share more information about later in the presentation in order to find places for help. Now, how can we help others? If someone on your team or work site comes to you and asks for help, a good approach is to be supportive and help, if you can, by listening to the other person, being a supportive presence, asking open-ended questions, and not being judgmental towards the other person and their experience. Also, seeking to understand where the other person is coming from, reflecting back to them their experiences, and affirming and acknowledging their experience and truth can be incredibly supportive. Also, accepting that asking for help is okay and normal. We are all going to be in need of help and support at some point in our lives, and this is a totally normal and common experience for individuals who work in a helping profession and serve others. Let's take a look at some resources that may be helpful. So finding local resources in your area, you can contact your local county or state crisis line system. Here in Multnomah County, we have access to a crisis line, which is staffed 24/7, as well as the Multnomah County or Department of Human Services Division. They have a really great website on accessing mental health care. And I think I mentioned that as well, local county and state mental health websites that you may find through the local Department of Human Services. Following up and contacting local colleges and universities that may offer free or sliding scale mental health counseling. You can call the Substance Abuse or Mental Health Services Administration, or SAMHSA, and their number is 1-800-662-4357, and request local services or providers through their behavioral health treatment locator that's on their website. You can also search for local support groups in your area, like Alcoholics Anonymous or Narcotics Anonymous, via their websites online. And if you've experienced recent grief and loss, you can also reach out to the local hospice organizations, and they provide free support groups. Again, I just wanted to remind everyone that we will be posting a summary of all of these resources shared today, along with a recorded webinar, on the VISTA campus in the next 2 weeks. We're also going to show you a list of national resources, and this is a list of resources that can also support your mental health. So we've shown you the National Alliance on Mental Illness, or NAMI, and both their phone number and their website, where they do have a Find Support tab where you just can type in your local zip code or city to find local resources. We did want to also post the Suicide Prevention Lifeline. This is a 24/7 resource that's available. The number is provided. You can also do a chat referral with them if you access the resource or their website online, which is suicidepreventionlifeline.org. The Veterans Crisis Line, if we have veterans out there, it's the same phone number to call for suicide prevention, but you press 1 and you'll reach practitioners who work solely with veterans. You can also reach out to the Substance Abuse and Mental Health Services Administration, or SAMHSA, their helpline, and then the U.S. Department of Health and Human Services mental health website. There are also warm lines out there, which is a peer-to-peer model where you can talk with other people who've experienced maybe similar issues or concerns, and you can access those, your local resources, your local warm lines through that website, www.warmline.org. And I hope you all can walk away with some new tool to add to your mental health or your self-care practice. It was a pleasure speaking with you all today, and I truly appreciate you and your service, and please take excellent care of yourself. Back to you, Jessica.
Thank you, Carrie, and thank you for all that wonderful information. I do want to share a few resources that are very VISTA specific. So for you VISTA members here on this webinar, I do just want to remind you of the VISTA benefits and resources that are available to you. With regard to your health care, the Affordable Care Act deems that mental health services are essential benefits, which means that all insurance plans must include these services. For VISTA members, if you have health insurance, you will want to check and see what coverage they provide regarding mental health services. If you have health insurance, then you're eligible for our health allowance plan, which allows you to be reimbursed for eligible expenses, such as copays and prescriptions. and we're going to post the information on healthcare.gov around mental health and substance abuse coverage. If you aren't required to have health insurance and you're legally exempt, you're eligible for our health benefit plan, which covers 3 outpatient mental health visits during your VISTA service term. Another exciting thing that's coming very, very soon that you will all more than likely be hearing about in the next week or so is telehealth. In addition to the elected health benefit, AmeriCorps VISTA members can access telehealth, also known as virtual care, at no cost. Telehealth allows VISTA members to promptly consult with board-certified physicians, psychologists, social workers, and professional counselors 24/7, 365 via phone or video chat. And as I said, it's at no cost to you. For more information and how to access the benefit, you can visit AmeriCorpsVista.imglobal.com. Just a quick note, telehealth will not be available in Arkansas until January 2018, but it is a brand new benefit that's coming, and you should get more information about that very soon. Also, just some other resources from your fellow VISTA members. We have a forum on the VISTA campus where people have been discussing mental health in the VISTA context. So check that out if you're interested in continuing this conversation with your peers. And we also have new resources for supporting opioid programming. So some of you may be serving in a focus area that deals with opioid support, opioid programming, a lot of great resources on the VISTA campus around that. So please check those out. We're going to start our live Q&A session here in just a minute, but before we do, we'd like your input to help prepare us for next month's webinar, which is a mental health question and answer. Carrie will be returning to facilitate this December webinar in order to discuss any additional mental health topics that would be helpful to you and your work with VISTA. So before we move forward, please share your ideas in the chat. Let us know what's one mental health topic you would like to learn more about. This will help us frame our conversation in December. We do these webinars for you, VISTA members, VISTA supervisors, so we want to make sure that, that we are answering those questions that you have. So just take a quick second to do that. Put that in the chat. All right, I'm looking through some of these. We're seeing like burnout. We're also seeing trauma, training on trauma-informed care. There's a lot about that. De-escalating the situation. Wonderful. Keep those coming. We're going to have the chat transcript for us so that we can compile these and help frame our conversation next month. So as you type those in, I also do want to now move forward to our evaluation. We want to know what you thought about this webinar. On the right side of your screen, you probably just saw a poll pop up, and we'd love it if you would just take a few moments to share your feedback about this webinar. We want to know what you liked, what you didn't like, what you want more of, and how we can improve this in the future. As I said, we do these webinars for you. We do them to answer a need that you have expressed. So please tell us, let us know. We want to hear from you. We read these every time we get them, and we do take everything you say to heart. So please do a quick evaluation so that we can make this even better. And as we do that, as you all take the evaluation and as you let us know what you're looking for next month's session, I am going to ask Jay, our operator, to help us get started with our question and answer session. Jay's going to come on the phone and let us know how you can ask a question over the phone.
Thank you, Jessica. To begin the question and answer session, if you would like to ask a question, you'll press *1 on your phone. You'll want to unmute your phone and record your name clearly as it helps me introduce your question. If you need to withdraw your question, it is *2. But again, to ask a question, it is *1, and it takes a few moments for those calls to come through.
Wonderful. Thank you, Jay. So let's go ahead and get started as we wait for calls to come in with questions over the phone. Let's go ahead and take care of some questions that are in the Q&A panel. Remember, if you have a question, please put it in the Q&A panel because that's how we track them. We can kind of queue them up and track what's been answered. So that really is a helpful thing for us. So the first question is, I'm going to direct this one to you, Carrie. Jacqueline here asks, how do I not think of myself as weak when I can't psychologically deal with direct interaction with persons with mental health disorders or experiencing a traumatic life event? I have suffered from some of these issues myself, and as a result, it seems to be a triggering effect. So she really wants to help, but it can sometimes trigger her. So what would be your suggestion, or how would you respond to Jacqueline's question?
I would be mindful of your own triggers and just knowing yourself in terms of when you're feeling stressed or when you're feeling really triggered, what happens with you, and then if you're meeting with a client that is, you know, in that kind of session, or your work with them is particularly triggering, if you can find time or a way to debrief with a colleague or a trusted friend or a family member after, but then also, you know, if there's a way you can kind of really increase your self-care practice, as well as, you know, accessing your own mental health care. If you're feeling increasingly triggered and that it's definitely starting to impact kind of your day-to-day, I would really recommend reaching out to a mental health provider.
Thank you, Carrie. So let's go ahead and look at some more questions that have come in. Really quickly, Jay, did any questions come in over the phone?
At this time, we have no questions over the phone line.
Wonderful. We did have another question around the health care allowance. The question is, does the health care allowance limit how many mental health visits they will cover copays for? So thank you for that question. Generally, the limit for number of mental health visits would be based on your insurance. So if you have a specific insurance, they may say you can only, you know, you're only valid for 50 appointments a year or something. Our healthcare allowance, the healthcare allowance that VISTA provides, reimburses you for essential benefits and essential, you know, copays, prescriptions. So if it is deemed essential by your insurance and you submit a claim, then it should be covered. I'm not aware of any after 50 visits, we won't reimburse anymore. It's generally, as long as it's essential, what your insurance deems is essential, that they will reimburse you for that. But if you did want to follow up before, you know, seeing another appointment just because you don't want to get a surprise of not being reimbursed, I would recommend calling our provider, which is IMG. All right, let's take a look here. We have a question from a VISTA supervisor. They ask, my VISTA service members cannot afford the copays or direct costs of accessing most counseling services, and the 3 visits aren't enough. The telehealth lines feel isolating and impersonal. What else is being done to consider this? So thank you for that question. We definitely don't want to put VISTA members, you know, in a situation where, you know, the cost of getting insurance is too high or that the copays are too high. I would definitely recommend, if your VISTA members have health insurance, that they have health insurance and they can use the allowance. There may be an opportunity for them to have their copays and things billed directly to IMG instead of them having to pay out of pocket and then be reimbursed later. They would need to discuss that with IMG to determine if that is possible in their specific situation. For those that don't have health insurance and are legally exempt and have the health benefit, the 3 visits is what's in our is what's allowed now. It can be revisited. We are always looking at ways to improve the benefits that are offered to AmeriCorps VISTA members. So I definitely will take your suggestion here about, hey, could we improve this? Could we add more? Because we want to make sure that we're serving VISTA members so that they can serve at their best capacity. So thank you for that. And if anybody else, you know, if anybody on this webinar, I should say, has found some cheap services or something that they found is really helpful, put it in the chat, because maybe the supervisor could help their VISTA members utilize some of those resources. Once again, I'm going to go to Jay. Jay, are there any questions over the phone?
At this time, no questions via the phone line.
Great, thank you. So we have a question here. It says, my father passed away this year, a few months prior to my service, and it's been rough. How do I cope with that while serving low-income seniors who remind me of my dad? So I'm very sorry to hear about the loss of your dad. Loss of a parent is never an easy thing. I am going to bring in Carrie. Carrie, this is not the same kind of question that we had before, but how would you respond to her question about how to kind of continue to do the work that she's doing, but still, trying to mourn the loss of her father?
Thank you, Rose, for your question, and I'm sorry to hear about the passing of your dad. I know I went through something similar during my VISTA service where I lost a family member, and I definitely struggled with that. I know what I found to be helpful was utilizing, local hospice organizations that accept, Medicare funding and private funding, they offer free support groups. And so you can find a local hospice organization through the National Hospice and Palliative Care Organization website, and that website's now posted. There's also, a couple of different books and websites that if you just want to learn more about, like grief response, I'd say also seeing a mental health counselor just to kind of work on your own grief. And since it's something that you're actively working with older adults at your site, if there was a way you could talk with your supervisor and see if there could maybe be a short period where you do indirect practice, where you're not engaging directly with the senior population, just that is triggering. And I would just think being mindful of how you're doing in your own triggers and grief response. And it may help if you can, beef up your self-care practice as well.
Thank you, Carrie. One more time, I'm going to go to Jay on the phone. Jay, as we look for questions in the chat, are there any questions coming in over the phone?
There have been no questions over the phone line.
Wonderful. Thank you, Jay. All right. Let's take a look at the next question here. We have a question here. It says, how can I deal with the idea of burnout from the limitations I face as a VISTA to where I can't do the activism direct service work that I want to do? So Carrie, once again, I'm pulling you in. You're my rock star today. You were a VISTA member, and you've had to do the direct service. And I think you mentioned here that you had to do the indirect service, I should say. You mentioned that you did suffer from burnout. So how did you handle that, and how would you recommend that she approaches burnout when she has to do the direct service or the indirect service while maybe wishing she could also do the direct?
Well, I know, thank you, Jess, for your question. And I know, as a VISTA, you don't have a ton of extra time, but I know what I found to be helpful when I was experiencing burnout was finding an organization that I could volunteer with on my off hours, and something that I was passionate about and that spoke to me. And I actually volunteered with a local hospice organization on the weekends during my off time. And so I think if you can go to handson.org and you can search for local kind of episodic service projects, if there's, you can just kind of, I'm not sure where you're located, Jess, but like here in Portland, we have a couple of different weekly periodicals that come out, like the Willamette Week, the Mercury, but they have some of those weekly, even like your local paper, they can post weekly kind of activist groups or just opportunities for you if you want to do something outside of work, find something that you're passionate about and where you can actually engage in that direct practice or that direct service practice.
Thank you, Carrie. Jay, any questions over the phone coming in?
None at this time.
Okay, thank you. Once again, if you'd like to ask a question over the phone, type in, call the number on the bottom of the slide and then press *1 and state your name clearly so Jay can queue you up. Another question that's come in, and I want to make sure I'm understanding this, so I feel like we're gonna answer it in two different ways. The question is, do you have some suggestions for how to de-stress while at work when you cannot leave from a project? So the first way I'm going to answer this is, I wonder if you're asking, I can't leave for the day, like I need to be at the office, so how can I de-stress in the moment? So Carrie, what are some good de-stress practices? If you just really can't leave the office, it's not like you could go home and just take a break for a little bit. you have to be in the office, what are some de-stressing techniques maybe that you've heard of or that you practice?
Thank you for your question. I'm thinking when you're at work and if you have 5 minutes, if you could possibly take a quick walk, or if you can get out of your building for just a short amount of time on a break, I think that can help to physically remove yourself from the environment if that's a possibility. Taking 5 minutes to listen to maybe a favorite song, or even to do a short meditation, which if you have a smartphone, there are a lot of different free apps that you can use to download meditation practices, as well as kind of self-guided visualization or relaxation practices. I know I will force myself to leave the front of my computer. I will walk away from my computer and just kind of do a lap around my building when I need to de-stress. You can also engage in breathing exercises and or grounding exercises, and we can share some of that content when we post the resources. But kind of a quick grounding exercise can just be, if you can kind of think about, look, listen, and feel, kind of, if you can sit and close your eyes, think about what you hear, what you're sitting on, and just kind of try to bring the focus back on your body, and that can really kind of just help you get into your body and can help with some of the relaxation and kind of just de-stressing in the moment.
Thank you, Carrie. The other way I could interpret the question that was asked is, how can I de-stress at work if I feel like I can't leave my project, in the sense that maybe you're unhappy at your project and you feel like you can't, end your service term, or you can't transfer to another project. If you're having a difficult time at your project site, the first person you should talk to is your VISTA supervisor. Let them know what's going on. Let them know what your feelings are, where you're coming from about this, to see if that situation can be rectified. There are instances where VISTA members, maybe it just isn't a good fit at that site, and there can be opportunities to transfer to a different site. But the first step is always to talk to your VISTA supervisor and see if something can be worked out there. If not, and you determine, and your project determines all of that, that maybe it's just not a good fit, you can contact your state office and determine if maybe a transfer is a better way to go. So I'm not sure how that question was meant, but those are those two answers. So the next question was with regard to the use of sick days and how can you use sick days. So each VISTA member is entitled to 10 personal and 10 medical/sick days during their VISTA service term. The sick days should be used in an alignment with their agency's policies. So if you're serving at like a Habitat for Humanity affiliate, when requesting sick days, all of those sorts of things, that should be according to the policy that your organization has set up. It's definitely worth a conversation with your VISTA supervisor to determine if mental health days can be used for sick days. As I said, it's based on the agency's policy on how they use sick days. So you want to have a conversation with them. Have a chat with them because, as Carrie mentioned in the beginning, it's proven that, having good mental health leads to having good overall health. So definitely have a chat with them and, see if that is something that can be utilized. Jay, any questions now over the phone?
Still no questions over the phone lines.
All right, thank you, Jay.
Thank you.
That's okay, we have lots of questions in the Q&A, so we're gonna get to those. Let's take a look here. Pulling down the next question. Let's see. I'm so sorry, my computer is acting a little slow here. Rachel or Jenny, can you pull up the next question for me? Is there another question that I'm missing?
Yeah, and next question is, my project is supposed to involve me reaching out to the community. However, I've had a hard time initiating other people and tend to get down on myself when I see those bubbly, energetic people that are good at that sort of work. What should I do? I think this would be a good question for Carrie.
Agreed.
Hi, Max. Thanks for your question. This comes up a lot in service work. I think we're put in new situations, new environments, and maybe doing some things that kind of just feel out of the norm for us. I know in my work we have outreach staff, and I am not one of those outreach staff. And I also have kind of found it difficult to reach out to these providers when you don't have, prior connections or relationships with them. And so what I found to be helpful is if you've seen these other energetic people that are doing this kind of work, if there was the ability to possibly shadow them and kind of just get a feel for how they do the work, and if they can give you any tips or just other recommendations and see what's best worked for them when they've started this kind of engagement work. If you could also, do informational interviews with those community partners that you're engaging, or if there's, somebody in those organizations that's kind of their role where they themselves are doing outreach, so trying to create those connections. But I know that this is difficult work, and that if you're, feeling down on yourself, I think that's a normal response. But I think this also kind of trends back to the talk we discussed earlier about resilience. You're still doing the work, you're still there, you're still showing up, and that it can only get, I think it can only get easier the more you engage and the more you work in the community.
Thank you, Carrie. So another question came in here around what is the best way to support a colleague reluctant, sorry, my computer just jumped around again, reluctant to acknowledge behavioral and emotional changes resulting from stress without violating reasonable expectations of privacy. What are your recommendations there, Carrie?
I would start depending on what your relationship is like with your colleague, if you would feel comfortable maybe just pointing out, just peer-to-peer, not in a group setting, but individually, that, hey, I've noticed that maybe you've been, more tearful during the workday, or I've noticed your mood has changed. I think just kind of starting, coming at it from a place of concern, and that you're not having this conversation with a colleague to be punitive, or that it's not coming from a negative place, but that it is coming from a non-judgmental, just a place of concern. So if having that discussion with a colleague isn't a possibility, you could always speak with a supervisor and let them know that you may be concerned about a member. You don't have to share their name, but that could possibly prompt further discussion from your supervisor at a next team meeting, or just sending out like general resources on mental health and mental health engagement. But I know that we do kind of come up against privacy and confidentiality with HIPAA in particular. And I know you not wanting to alienate that colleague, but I think just being as open and available as you can be for them, and hopefully they'll be able to come to you when they're ready.
Thank you, Carrie. Another question has come in. Any suggestions for taking time / prioritizing self-care when the rest of your organization, maybe the supervisor and coworkers, seem to be overworking and not taking time for self-care, to make you feel like you aren't working as hard or as dedicated to the work? I think this is a struggle probably a lot of us run into. So Carrie, how do you recommend people balance that? It's hard when, I want to take care of myself, but I also don't want to be seen as not a hard worker.
I know, I totally recognize this struggle, and I mean, I see it in my organization. I see it this on a day-to-day basis, and I think we need to focus on ourselves first. And if we're seeing these traits in our colleagues and our supervisors, I think it can actually make us more mindful of our own practice and of how we're just taking care of ourselves, at work and off work. I think if there's possibly any opportunity, just if there's a staff meeting or kind of an open forum where you could just bring up self-care in general and not have it be targeted towards a colleague or a supervisor, but just kind of to recognize and note, hey, we're taking care of others, and in order to be able to do that, we need to take care of ourselves. And I think that the fact that you're thinking about your own self-care I think that just shows how dedicated you are to the work and how hard you're working, because you're trying to strike that balance. And, I think that's really wonderful and something to recognize in yourself that you're already engaging in. I think this is part of being resilient, engaging in self-care, is having these discussions.
Thank you, Carrie. Jay, are there any questions that have come in over the phone?
Again, none at this time. Great.
One question that came up with response to another question was regarding the use of sick days. Someone had mentioned that, hey, I may not feel comfortable talking to my supervisor about this type of question. So my recommendation for you, if that is a concern of yours, is to talk about this question in the context of having attended this webinar. You can say, hey, I just attended one of the offerings that VISTA did for a webinar. They suggested we talk to you about, how we handle mental health in this office and how we handle, stress. And, they talked about our benefits, and I know we get sick days. Is mental health days something that we can use? How do we, use it for doctor's appointments? This is a great segue for that. So it's not just, if you're concerned about, the stigma that may be associated with asking that type of question, that could also help. I also want to bring in Carrie. Carrie, do you have any suggestions? If your organization is not necessarily very forthcoming with saying, yes, mental health days can be used for sick days, how would you recommend someone approach this kind of a sensitive topic?
I know in my current work environment, so we have sick days, and then we have like vacation days, and they're kind of all jumbled together. And kind of the instruction I've received from my supervisor is when you're not feeling well, whether that be physically or mental health-wise, you can just say you need to take the day off or that you're feeling sick. You don't have to give a reason. At least, in my organization, we don't have to say why we're taking the day, just that we're taking the day. So I think, if share as much information as only that needs to be shared. Don't go into detail. And I don't want this to, create any issue or concern with your supervisor at your work site, but just genuinely saying or letting the people know you just need to take the day. And I think if you can just leave it at that, that may be the best approach.
Thank you, Carrie. Another question that came in is, what if the biggest trigger to these feelings of being trapped, isolated, stressed are financial insecurity and questioning your own effectiveness as a VISTA? Are there any suggested coping mechanisms or resources for that? So let me break down this question a little bit. What is the biggest trigger of these feelings being trapped, isolated, and stressed? And there are financial insecurity concerns, and then also your effectiveness as a VISTA. So, let's go to the second part of that question. How do you handle the triggers of, feeling trapped and isolated and stressed at the same time when you're questioning your effectiveness? So it's kind of pulling you in different directions, like I'm stressed, I feel trapped here, but I'm also wanting to do a good job and I'm feeling like I'm not effective. Carrie, how would you recommend someone, I don't want to do some good self-talk here. How would you recommend someone kind of handle this, these kind of tug-of-war of feelings that are going on in that kind of a situation?
Well, thank you for this question, and I think it's really great that these are things that you're thinking about and considering and recognizing. And, in terms of, feeling these things and questioning your own effectiveness as a VISTA, I think this is probably quite a common feeling or kind of a common response, especially, it's depending on where you are with your service year. But I think first, trying to address those feelings of feeling trapped, isolated, or stressed, because, I think regardless of where they're coming up, whether it be questioning your own effectiveness, around the financial insecurity, I think if you could try and address those feelings, if you can try to increase your self-care and doing self-care that may not have a large cost, whether it be if there's, if you have a smartphone, downloading free apps on your phone to utilize, for coping skills, utilizing your local library for books, movies, music. I mean, things that may not have a huge financial cost, because I know that that is definitely a struggle. I think in terms of questioning your own effectiveness in that role, if there's a way to reference, prior to VISTA's work in your role, and just to kind of see what they were doing, what may have been helpful. If there's a way that you can talk with your supervisor at your site, or your VISTA supervisor, if you want to have a discussion with them about how you're doing, or if you have that discussion with them about maybe what could I be doing different. But I also want you to recognize that you are doing good work. And that there could always be room for growth, but the fact that you're there and you're showing up, that you can be effective, even feeling like you're not being effective. But I think if you can have a discussion with your supervisor around that and discuss what things you may also need to do your job better, and that could be a point of conversation with a supervisor.
Thank you, Carrie. What, or if any questions do we have on the phone, Jay?
At this time, there are no questions from the phone line.
All right, thank you so much. Rachel or Jenny, are there any questions that have come in that I may have missed in scrolling through all of these?
No, I think we have covered the ones that have come in on the Q&A.
Wonderful. Well, it seems like there aren't any lingering questions left, but you will have another opportunity to chat with us in December around this topic. I do want to say thank you all for being here. Thank you for taking the time to attend. For VISTA members and VISTA supervisors alike, I'm happy to see you both here and joining us today. Thank you again to Carrie for providing this wonderful information for us. And thank you for coming back next month to help answer more of the burning questions that people have. So we're going to stop here. We're going to let you go for your day, but we do want to just talk about our upcoming webinar series for you all. So our next webinars that are coming up are, as we've mentioned, next month we have a member and supervisor mental health Q&A with Carrie. That'll be on December 19th at 2 p.m. And then our next VISTA member webinar is around VISTA benefits and taxes, just the basics. Brand new webinar to discuss the ins and outs of taxes. It's going to be great, and it's on November 20th at 2 p.m. Eastern. So we hope to see you there, and we look forward to seeing you next month at the mental health Q&A. So thank you so much, and have a great rest of your day.